Hi, another quick video for Stockport Sling Library. This is how to use a Tula Explore in the forward facing out or parent facing, world facing out position. This is normally recommended from a minimum of 5 to 6 months roughly for Tula Explore, and this is how you would do it. Okay, so I have my Tula Explore. Basically the first thing you need to do is you'll notice that there are two buttons that are on the front of the panel, a button here and a button here. You need to adjust this button so it's on the inward position button. This one is used for forward facing inwards and for back carrying. So this one, if you just move it to that narrower position, you'll see there it just narrows the size of the panel. Okay, then we're going to pop the waistband on like so. Now this is a Coast mesh version of the Tula Explore, but it's exactly the same for the standard Tula Explore. I am going to fasten up my chest strap because I find it quite difficult to clip it in around my back. Give myself some space to get baby in. Okay. Pick up baby and place them as centrally as you can, just on the waistband. Legs are going to go either side of the panel. Then you're going to gently push the panel upwards until it goes under their chin. I'm going to pop this over my head, feed my arms in. Like so. And we're nearly there now. So, baby's arms, now they can go out of the side here, or they can also go over the top here if they wish. Just see which looks better for your baby and your baby's size. As I said, this is only recommended from really about 6 months. This baby, their arms look better coming out of the side here. And then I'm just going to tighten up by pulling forward. And I can also tighten up the back strap by just grabbing hold of that and tightening that up a bit on the back as well. Yeah. So I'm just going to make sure that the pelvis is tilted as forward as it can. Now normally we would slide our hands in and tilt the pelvis towards you, but obviously with baby facing outwards you want to try and tip that pelvis forward, so upwards this way, so that it brings their legs up. Just trying to get those legs up as much as possible and supported under the knee, so the bottom is lower and the knees are higher, and it's still a nice ergonomic position. What we want to really make sure, this baby's a little bit small, so I'm going to door's going to slap. Want to make sure is that the baby's chin is really clear of this panel, and this doll is just about the right size for that, but you want to really make sure that that chin is clear of there. And that's it. That's how you forward face with a Tula Explore. Try and make sure that the waistband is as tight as you can. If it's not tight, what will happen is that it will tip forward and all the baby's weight will really be forward, and it will pull on your shoulders, your neck and across your back, and that won't be comfortable. Worth noting that most manufacturers only recommend forward facing outwards till 12 months. This is mainly because of the weight distribution, and it's going to be very uncomfortable for your back with the baby's weight all forward. It also sort of has an effect on your centre of gravity when all the baby's weight is forward this way. So after around 6 months, when baby can sit unaided, and obviously going up towards 12 months plus, on your back is a really good alternative to forward facing out. But that is basically how you would forward face out. You would make sure that this panel, this headrest is always down when you're carrying in this position. Okay, and then to get baby out, you just release the straps a little bit, unclip the back chest strap, and then you just peel it downwards, and there you're good to lift baby out. Okay, thank you.